So herpes are large enveloped viruses that contain isodeltahedral capsid and double-stranded DNA genome. There are three main subfamilies. We have alpha herpes virus, beta herpes virus, and gamma herpes virus. So alpha, we have herpes 1 and 2. So it's called HSV, herpes simplex virus 1, herpes simplex virus 2, and then varicella zoster virus. For beta herpes, we have CMV, which is herpes 5, human herpes virus 6, human herpes virus 7. And then for gamma herpes virus, we have EBV, which is HHV4, human herpes virus 4, and HHV8. Okay. Set up latent or persistent infection following primary infection. Reactivation are more likely to take place during periods of immunosuppression. So what that means is you get the virus, then when you get it, it stays in your system for some time. Then it becomes reactivated when you're in a state of immunocompromise or in an immunocompromised state. Okay. So for example, if you get HIV, if you get chemotherapy drugs, if you get things like diabetes, or if you are a transplant patient. So since transplant patients receive these drugs called immunosuppressants to prevent reaction of the organ. So for example, if you got a kidney transplant, a liver transplant, a heart transplant, you're at an immunocompromised state. Then both primary infection and reactivation are likely to be more serious in immunocompromised patients. Okay, so we'll be tackling mainly the alpha herpes viruses. For these, I'll just mention the higher things you have to know. Okay, so for herpes simplex virus infection, we have herpes virus are a group of DNA viruses that cause a variety of infections in humans and animals. There are several types of herpes, each capable of causing distinct conditions. The two most common herpes viruses that infect humans are herpes simplex virus and varicella zoster. Then HSV is divided into 1 and 2. Okay. So we enter. We want to discuss herpes simplex virus 1. So this strain commonly causes oral herpes. So I want you to remember that. If you remember herpes simplex 1, oral herpes, herpes simplex 2, genital herpes, you're okay. Okay? It's characterized by cold sores or fever blisters around the mouth and on the lips. However, it can also lead to genital herpes through oral genital contact. But the most common thing we're thinking of is the oral herpes. Then herpes simplex virus 2. This strain primarily causes genital herpes, resulting in painful sores in the genital area. However, herpes simplex 2 can also cause oral genital through oral genital contact. Okay, so vice versa. Herpes simplex 1 can also cause genital, and then simplex 2 can also cause oral. Okay, so the oral herpes, primarily caused by herpes simplex virus type 1. Symptoms often result in cold sores or fever blisters around the mouth and lips. Symptoms may include tingling, itching, or burning sensations before the appearance of blisters. These blisters eventually break, forming painful sores that uncrust over before bleeding. Okay, so we're going to see a picture. Okay, so I'm going to show you a picture. I have a picture here of the genital sore. Let me see. This is the genital sore. Okay. Then transmission typically transmitted through oral contact, such as kissing or sharing utensils with an infected person. It can also be spread to the genital area through oral genital contact, resulting in genital herpes caused by HSV1. Okay. Genital herpes, so mainly HSV2, but it can also result from HSV1. It results in painful sores or blisters in the genital area, including the vulva, vagina, penis, or anus. Symptoms may also include itching, burning, or tingling sensation before appearance of lesions. Like oral herpes, these blisters eventually break, forming ulcers that scab over and heal. I want to show you a picture. As you can see here, on the penile shaft, here are the lesions. Then it's found all over the buttocks. And then this is the vulva. As you can see here, the numerous lesions caused by herpes simplex virus 2. Transmission, sexual contact, including vagina, anal, or oral sex. It can also be spread to the mouth through orogenital contact. Then causative agent, as we had said, HSV1 and 2. These viruses can infect various parts of the body, establishing latent infections in nerve cells after the initial infection. So basically what happens is it enters your body, goes and affects the areas we've mentioned, then it can stay latent in your nerve cells, waiting reactivation. Then pathophysiology. So this is how it happens. We have entry and initial infection, then replication and spread, establishment of latency, then reactivation and recurrent outbreaks, leading to an immune response. Okay, so this is how the order goes. So I'll explain. Entry and initial infection. So the different ways you can get herpes: through direct contact with infected skin, mucous membrane, or bodily fluids. For the entry point, the virus enters the body through breaks in the skin or mucous membrane, where it gains access to epithelial cells. So imagine if you have a break in the mouth, like if you have a cut or any sore, the virus will enter. Then it goes to the epithelial cells. Once it's there, the HSV binds to receptors on the cell surface, allowing entry into host cells. Once inside, the virus releases its genetic material, which is DNA, into the host's nucleus. And once that happens, viral DNA replicates within the host cell, producing viral proteins and new particles. So the replication cycle occurs since we have already embedded into the host nucleus. Then from there, the virus can spread to adjacent cells, causing lytic infection and tissue damage. This process leads to the formation of characteristic lesions or blisters associated with HSV infection. So it has entered the cell, bound to the receptor. It embeds its DNA into the host nucleus. Then replication occurs. Once replication occurs, it's forming new virus particles and proteins. Then it affects the adjacent cells, causing more damage, leading to the lesion or blisters. Okay. Then after that, we have establishment of latency. Nerve cell invasion. After the initial infection, HSV travels along sensory nerves and establishes latent infection within the nerve cells. So it's usually in the sensory ganglia near the initial site of infection. So if it's around the mouth, we can think of which sensory ganglia. We have the trigeminal ganglia. We have, so all the nerves that are around the mouth. So that's where it's going to establish its latency. So during the latency, the viral DNA persists within the nuclei of neurons, without causing active replication or symptoms. The virus evades the immune system during this dormant phase. So this virus, it's trying to escape the immune system. So it goes, hides into the nerve cell nuclei, awaiting when your body is immunocompromised, it's going to reactivate. Okay. Reactivation. So various factors, including stress, illness, hormonal changes, UV exposure, or immune suppression, can trigger the reactivation of latent herpes simplex virus. Reactivation leads to the transport of the virus back along the nerve fibers to the initial site of infection, resulting in recurrent viral replication and the emergence of new lesions or outbreaks. So the same pathophysiology, as we had said, but this time you are being immunocompromised, then travels back to the initial site of infection, causing the earlier symptoms. So immune response, the innate and adaptive immune responses. So innate is the natural immune response. The body's immune system plays a crucial role in controlling and limiting herpes simplex virus. Innate immune responses initially combat the virus, followed by adaptive immune responses involving antibodies and immune cells that help control but do not eliminate the virus. Okay, so that's very important. It will fight off the infection, but it will not eliminate the virus. So here are the stages. We start with redness and tingling sensation in the infected area. As you can see here, the appearance of a liquid-filled blister. So if you've ever seen it, it becomes a clear fluid, okay? And then the blister are bursting, and in their place appears a solid scab. So once it bursts, it becomes solid. You're going to see there, as I'd shown in the picture. Okay. Then these are the general symptoms. We have cold sores, itchiness, pain, and then genital sores. Clinical manifestations for oral herpes, painful blisters or cold sores around the mouth, lips, gums, or throat. We have fever, swollen lymph nodes, and general malaise. So these are very non-specific symptoms, but they can occur. Pain or soreness during eating and drinking. Sometimes lesion can spread to the inside of the mouth or on the tongue, okay? Depending on how damaged or how much it's spread, it can affect the mouth. Then here is the lesion. So this looks like a scab. So it was a blister, then it burst, then it formed the scab. For genital herpes, similar. Painful blisters or sores in the genital area, including the vagina, penis, buttocks, and anus. Painful urination. So you have to take note of this. Herpes causes painful urination. As you're going to learn, syphilis, which is a bacteria, usually causes painless. As much as, yes, it's an STI, but it's usually painless. Okay? Fever, headache, muscle aches, and swollen lymph nodes in the groin area. Lesions may cause discomfort or itching. So as you'd seen here, the shaft of the penis, the buttocks, and the vulva. Okay, now we want to look at other clinical presentations for both herpes virus, simplex virus 1 and 2. Acute gingivomstomatitis. So normally what happens is, this is caused, as you can see here, these are lesions. They're around the lips, tongue. They can sometimes extend to the throat and the pharynx, and they're very, very painful, okay? So the patient will come and tell you, I'm having a very painful sore throat. And then on examination is what you'll see, these vesicles and the blisters around the mouth. So the commonest manifestation of primary hepatic infection, primary meaning you've got it for the first time, pain and bleeding of the gums, 1 to 8 millimeters ulcers with necrotic bases are present. So if you're seeing areas of necrosis, means like when you shine a torch, you're going to see some black areas. Then self-limiting disease, which lasts around 13 days. So it's self-limiting since the immune system will try and clear it. But the problem is it's going to go and stay latent. Then we have recurrent infections. Recurrent episodes are typically less severe than the primary infection. Individuals often experience prodromal symptoms, tingling, burning, or itching sensation before the appearance of lesions. Then lesions tends to be milder and heal faster than during the primary infection. I think we had mentioned this. Then the systemic symptoms. Some individuals may experience flu-like symptoms during primary or severe recurrent infections, including fever, headache, fatigue, and muscle ache. We have neonatal herpes. So neonatal herpes usually caused by herpes simplex virus 2. The neonates are born to mothers with active genital herpes can develop severe infections. Symptoms can include skin, eye, mouth, or CNS involvement. So when there's CNS involvement, is usually meningitis, okay? Neonatal herpes can be life-threatening and requires immediate medical attention. So for neonatal herpes, as much as yes, it is very severe, it does not usually cause congenital defects. I remember we said rubella, we had done rubella. We said rubella can cause congenital defects. But now for neonatal herpes, it will cause, it's severe because it affects these organs, but there's no congenital defects. Then we have hepatic whitlow. Whitlow is more common in herpes simplex virus 1, a herpes infection on the fingers, often seen in healthcare workers or individuals who come in contact with active lesions. They are painful lesions on the fingers, causing redness, swelling, and sometimes blistering. So here it is. You can see here, these are the blisters that are formed on the finger, quite common. So they bring you a picture like this on exam, then they ask you, which virus caused this? So you know it's herpes simplex virus type 1. Then we have herpes simplex encephalitis. It's usually caused by herpes simplex virus 1. Most serious complication, okay, for herpes simplex virus. So clinical symptom, we have the meningitis symptoms. You're going to hear them. We have fever, headache. You can add here neck stiffness. Then we have seizures, focal neurological signs, and impaired level of consciousness. So the patient will come in confused, or they may come in a coma, okay? So that's what we call impaired consciousness. Then in the absence of treatment, prognosis is extremely poor with a mortality rate of around 70%. So in these patients, we have to be really, really fast. So treatment for herpes-related encephalitis includes supportive care as well as intravenous antiviral therapy. And the drug of choice is acyclovir. You have to remember this. So in exam, they can bring for you a picture like this. Then they ask you, what is the drug of choice for the treatment of this? So this is herpes simplex encephalitis. So normally it affects the temporal lobe. Can you see here? Yeah. So we usually call it temporal lobe encephalitis or herpes simplex encephalitis. One thing you can see is presence of red blood cells in CSF. So when you do a lumbar puncture, you can see that. And then they'll ask you the drug of choice, acyclovir. So you have to remember that. Okay. Then one thing I can add is here in neonatal herpes, I said it causes viral meningitis. So meningitis can occur in both herpes simplex 1 and 2, but the most common is in herpes simplex 2. So viral meningitis is more common in herpes simplex 2. Take note of that. And then For latency, if I was to mention herpes simplex 1, we said it's spread through oral route. It is most commonly latent in the trigeminal ganglia. Okay. Then herpes simplex 2 is most commonly latent in the sacral ganglia. So that's something I forgot to add, but you should take note of that. So herpes simplex 1, where it stays latent most commonly is trigeminal ganglia. Herpes simplex 2, sacral ganglia. That's also high yield, you should know. Then for diagnostic evaluation, we can do viral culture, PCR, to get the virus DNA, fluorescent antibody test to see antibodies against the herpes, and then serological tests. Management, as I had said, acyclovir, usually the drug of choice for herpes simplex virus. Acyclovir, you can also use peniciclovir. Then oral medications. So these are topical. So for example, if you have those sores or lesions, you just apply. Then for oral, you take acyclovir or valacyclovir or famiciclovir. Then acetaminophen for pain. So acetaminophen, commonly called paracetamol or ibuprofen, used for the pain management. As we said, it can really be painful, especially the sores. Then we have supportive measures. Keeping the affected area clean and dry can aid in preventing secondary bacterial infections. So secondary bacterial infections can occur in areas where there are sores. So you can find that bacteria that are found in the mouth that are part of the normal flora. So normal flora means that they are part of the bacteria that reside in the mouth but do not cause disease. So they can, when you're at a state of immunocompromised and then you get the herpes infection, this bacteria can start multiplying and then you get more bacterial infections. It can also be fungal. And applying cool compresses or ice packs to the lesion will provide relief from pain and inflammation. Then adequate hydration and maintaining good hygiene are essential during an outbreak. So these are the supportive measures. Prevention. So herpes simplex 1, avoid direct contact because it's spread through things like kissing. Avoid direct contact with active lesions to prevent transmission. Then herpes simplex 2, practice safe sex, including use of condoms, can help reduce the risk of transmitting genital herpes. How to treat a herpes outbreak. So this is a picture I found on Google. Use an ice pack to help lessen pain. Antiviral medication. Reduce stress to prevent recurrence. Keep the sores clean. Try over-the-counter antiviral therapy. And do not touch or scratch. As I said, touching and scratching leading to the sores can cause concomitant bacterial infection. Then complications. We have outbreaks, spread of infection, and then complications in pregnancy. As we had said, neonatal herpes can occur leading to meningitis. Complications in pregnancy. Pregnant women with genital herpes can transmit the virus to their babies during childbirth. This can lead to neonatal herpes, a serious condition that may result in brain damage, developmental issues, or even death in newborns. Cesarean section delivery may be recommended for women with active genital lesions close to delivery to prevent transmission. Okay. So if you're pregnant and you have an active herpes infection, they usually do cesarean mode of delivery to prevent the mother-to-child transmission or vertical transmission. Then systemic infections. In rare cases, especially in individuals with weak immune system, Herpes simplex virus can cause systemic infection that spread throughout the body. This can lead to conditions like disseminated herpes infection, affecting multiple organs and potentially becoming life-threatening if not treated promptly. So for this, not that common, but it can occur if you have so much virus in blood. So if you have viremia, it can spread to other organs, leading to destruction. But this is not that common since your immune system is going to fight it. So in a person who has something like HIV and then you get reactivation of the herpes, or you get primary herpes, at that point is when this can occur. But for the symptoms that I've told you guys, those are the most common you're going to see in someone who has herpes. Meningitis and encephalitis. So as I had mentioned, meningitis more common in herpes simplex virus 2, encephalitis more common in herpes simplex virus 1. Increased risk of HIV transmission. So this is an STI. It can increase your risk of getting HIV. So this is because you have the multiple open sores and lesions, which can be entry point for HIV. Then psychological impact, living with recurrent herpes outbreaks can lead to psychological distress, stress, anxiety, and social stigma due to contagious nature of the infection. Prevention, we had mentioned. Yeah. Any question on herpes? Simplex virus 1 and 2?